Recorded Books presents Modernizing Medicare, Harnessing the Power of Consumer Choice and Market Competition. Edited by Robert Emmet Moffit and Marie Fishpaw. Narrated by Alan Peterson. Chapter 1. Robert Emmet Moffit, Ph.D. Introduction. Reviving the Medicare Reform Consensus. In 1996, the editors of the New York Times hailed a new consensus on the future of Medicare. When it was created in the 1960s, Medicare gave the elderly the same fee-for-service coverage that everyone else used. But now, Medicare stands nearly alone in providing the most expensive healthcare choice at huge taxpayer expense. One result has been a growing consensus among ideologically diverse people that the structure of Medicare must change. The list of reformers includes Nancy Johnson, the House Republican from Connecticut, Ron Wyden, a Senate Democrat from Oregon, the Brookings Institution, a liberal-leaning think tank, and the Heritage Foundation, a conservative think tank. The latest addition to the list is the American Medical Association, the physicians group that tried to scuttle Medicare at its inception. The Times editors neatly summarized the fundamental point of this remarkable bipartisan consensus. Their proposal mirrors the market-based system that gives millions of federal employees a wide range of choice of health plans. It allows the elderly to stick with the traditional fee-for-service government-run program, a deft political stroke that could take the fear out of reform for many elderly. Retirees could choose instead a private managed care plan that offers additional benefits, like coverage for drugs or lower fees. They would pay more for expensive plans and receive rebates for choosing inexpensive plans. These defined contribution advocates soon made some progress. The Balanced Budget Act of 1997 created the National Bipartisan Commission on the Future of Medicare, chaired by Senator John Breaux, Democrat, Louisiana, and Representative William Thomas, Republican, California, and chairman of the House Committee on Ways and Means. In 1999, the majority of that commission proposed transforming Medicare into a premium support system of financing while also restructuring it based on the Federal Employees Health Benefits Program. While the Breaux-Thomas recommendation failed to command the support of either the Clinton administration or Congress, the Bush administration succeeded in making a big step in its direction by enacting the Medicare Modernization Act of 2003 and creating Medicare Advantage and Medicare Part D, the prescription drug program. Both programs were systems of competing private plans, and both, though differently structured, were financed on a defined contribution basis. In 2012, Representative Paul Ryan, Republican, Wisconsin, and Senator Ron Wyden, Democrat, Oregon, revived the premium support proposal, and the bipartisan idea again attracted staunch support within Washington's diverse policy community. The Wyden-Ryan proposal, however, faced inveterate opposition from the Obama administration and its congressional allies. The impending financial crisis. Medicare is facing an immediate fiscal challenge. The Medicare Board of Trustees reports that the Medicare Hospital Insurance, HI Trust Fund, the account for Part A hospital and related medical services, will be insolvent in 2028. Insolvency in this Medicare context, incidentally, doesn't mean bankruptcy in the sense of a total financial collapse, the sort of catastrophe that destroys a private sector firm. Rather, it means that the Medicare Hospital Insurance Program will not be able to pay for all the promised Medicare Part A benefits. The timing of trust fund insolvency is, of course, dependent upon economic conditions and payroll tax revenues. The anticipated Medicare hospital payment reduction, assuming trust fund exhaustion in 2028, would initially amount to 10%, and, absent remedial action, the annual payment cuts would continue and progressively deepen thereafter. Such reductions in payment for medical services, the medical trustees warn, would directly hurt the beneficiaries dependent on those services. Beneficiary access to healthcare services could be rapidly curtailed. The
Sample complete. Ready to continue?